and welcome to Glamour Live. I am the online editor for GLAMOUR South Africa, Molifa Kumona. Thank you for joining us for yet another live chat that we have, and thank you. We hope you're staying safe, keeping safe. Word Warrior Koza, thank you so much for joining us. Kirsty, thank you for joining us. For everybody who's joined us, thank you so much for joining us. This evening, we are talking to what we like to call a frontline fighter, a young doctor who is at the front line in the fight against COVID-19, basically one of the essential workers who is at work protecting us. So thank you so much for joining us. We're just going to wait for Dr. Bizos to join the conversation and we can have this very important chat. So we're talking about everything COVID-19 with Dr. Bizos. We're just joining now, we're connecting to... Well, my question is down here, so I will be looking through the questions as we go. Just connecting to Dr. Bizos. Hi, Dr. Bizos.
How are you?
Good, thanks, and you?
I'm fine, thank you. Thank you for having me.
No, thank you for agreeing to do this. Can you see me? Can you see me, hear me clearly?
Yes, I can.
Cool, perfect. So thank you once again for what you're doing for us as a nation. I mean, you are on the front line, one of the frontline doctors, just in terms of this fight against COVID-19. Before I get into the questions, can you just tell us briefly what's that like? What is that like? We know how it is from home, when we're at home trying to stay safe, but in terms of you as an essential worker, what is that like?
So I think I should just make it clear in the beginning, from the get-go, that I'm not an epidemiologist or virologist, so I'm not a specialist on COVID-19. I want to give you all the information as best as I possibly can, and I think that it's important that our viewers that are all joining in currently are reminded that they can gain good information from very good resources such as the WHO, the NICD, and the Department of Health that are currently updating information daily. So as a frontline worker, I mean, I think as doctors, we deal with patients from a different spectrum of health daily. And even before COVID, I do feel that we have always been here fighting on the front line for the healthcare of our fellow South Africans. So it's although it is scary, and although all of us are scared, we are brave, and we're ready to fight this as doctors, as young doctors and essential workers.
So before we get into COVID-19 and the discussion and questions I have, why did you choose to be a doctor?
So I think as a young girl, I grew up in a family of doctors. So my father's a doctor, my grandfather was a doctor, and I was always exposed to watching my dad do good and making a difference in the world. And I think that was, the most poignant moment of my life, where I realized that it was something that I could do to make a difference in the world and help others who are suffering. So that's
cool, definitely.
It.
So I'm just going to go through the questions as some of the questions we sent to you. If you're looking at, you've always been on the front line of the fight of various things, right, as a doctor. But looking at COVID-19, what would you say that this whole experience has taught you as someone who's on the front line and just basically as a medical essential worker?
So I think the virus has reminded and taught all of us as doctors, as anyone, essential workers, that it's taught us a deeper sense of humility. I think it's reminded us that we are not invincible. And I think it's humbled all of us to a position, to the position that we currently are in right now.
Mm. And in terms of on the ground, what's happening on the ground? I know maybe 2 weeks ago, I had a friend who had he had to have his appendix removed, and if you wanted to go visit, you were not allowed to get in. You was leaving things outside by the door. What's the situation like in terms of at the hospitals? How? Yeah.
So I'm actually a medical officer in general surgery. So
Mm,
what has happened in our hospital is we have had to cancel all elective surgeries. So this includes anyone who needs an operation, which is not an emergency, has now been called and told that they will be called at a later stage to get their surgeries done. Anyone that comes to the hospital needs to be a patient. So as we
mm,
said, we are not allowing visitors at all at any public
mm,
hospitals or private, I think, for that matter.
mm,
And any patient who wishes to come to the hospital needs to be screened outside of the hospital in our screening tents that we've set up currently.
mm,
So there are 3 tents outside my hospital specifically, and patients who seek medical care come in, they get screened, they then get seen by a doctor outside who's in PPE if they're suspected to have coronavirus, and then we test them adequately. If we feel that they are mild and their reason to be at the hospital can be done electively or at a later stage, we ask them to self-isolate at home, but we obviously warn them on the danger signs and when to come back immediately. And this is in alternative to a patient like your friend who had an appendix, who needed an appendicectomy, and would have obviously been screened appropriately and been taken into the hospital, but in a separate area to where COVID
yeah.
patients currently are.
So in terms of COVID patients, right? You said when people come in and they suspect that they have um, someone has COVID-19 when you come in. What is the procedure with that, and when can you say that okay, it's okay to admit me or to test me? How does that work? Because we've heard a lot of reports where some people have been saying that we've tried to get tested, that was not possible. So what's the process with that?
So there's a screening process that happens outside in the screening tents. There's specific questions and criteria that a patient has to meet to be tested. Unfortunately, we
Mm,
don't have enough tests to test everyone,
mm,
so we screen
mm,
appropriately, and anyone who fits the criteria then of being appropriate for testing will then be
mm.
seen by a doctor and tested. So that's happening currently in state.
That's it.
Sisters also outside, and doctors then assess the patient, assess their symptoms, and then decide how severe they are. If they're mild and
Mm,
they still are currently doing okay and feel or are fit enough to go home, then we ask them to self-isolate at home. But if they are experiencing severe symptoms, then they do get admitted or seen in the hospital, obviously in a separate isolated section.
okay. And Buso is asking, he says, salute you, Dr. Agi. How has the pandemic changed the way you view your job?
That's quite a difficult question. I think that my job as a frontline worker and as a doctor is still the same. We are still helping
Mm,
people. We're still
mm,
making a difference.
mm,
It's just the sickness or an illness that has changed things currently. But Our jobs haven't changed, and I feel that we always have been doing this from the beginning. I think it's important to keep calm and just to keep doing what we've always been doing and give people the right advice and the right treatment. I think that's the most important message that we need to get across, and how to combat this. But being a doctor, whether it was before COVID or after, it's still the same job.
So I've got a question here from Marika of Farrell, who says, could you please explain the respiratory physiology with respect to the ground glass appearance on the chest X-ray? Why do these patients deteriorate when they are on ventilators?
Whew, that's okay. So let me just read that question. Could you explain the respiratory physiology with respect to? So acute respiratory distress syndrome is a type of respiratory failure. It's characterized by rapid onset of widespread inflammation in the lungs. The ground glass appearance on chest X-ray is just a way that we use a description to describe basically what we see on X-ray. It's not isolated to COVID. It's something that we use to describe multiple lung pathologies. And so in essence, why do these patients deteriorate on ventilators? It's difficult to say right now. I think I'd have to research this more and get back to you.
So in terms of, we've heard stories about reinfections. Is that true? And in terms of COVID reinfections, where someone has had COVID, they've recovered, and then they've gotten reinfections. Is this true? And if so, can you shed some light on that?
So I think there have been reports of reinfections in Japan and South Korea. Currently, to my knowledge, we haven't had reinfection, or we haven't seen any cases of reinfection currently in South Africa. Scientists are not too sure what the cause is of reinfection. It could also be related to the fact that the disease wasn't actually completely recovered, so the patient actually didn't completely recover from the disease, and that's why they're still testing positive. So that's one of the examples. Another example is that there may have been a false negative or false positive test, as the testing is also something that changes in reliability. Yeah, but we're still learning. The tests are still new, and they're still being refined. So with regards to retesting, as I said, we haven't really seen it in South Africa as of yet, but we still have a long way to go.
And in terms of Ms. Cole is asking, do you agree with the lockdown?
Yes, I do. I definitely do agree with the lockdown. I think that our president, Cyril Ramaphosa, has done an incredible job. Essentially, this virus has the potential to grow exponentially. And if you look at the way that our curve has flattened since the date of lockdown, it's actually something incredible to see. It's something that has really bought us time. It's stopped the spread currently, and it probably was the best decision made as of yet for our country. We are doing so well. If you compare us to the UK and the United States, we're really doing well currently as a country in fighting this disease.
And what would you say is the connection between financial health and physical health? In terms of, if you look at countries like the US, the minorities, for example, African Americans and Latinos and Spanish people are the ones who are passing away due to this virus. So, in your opinion, what is that connection, financial health and physical health, and why is it important for a country like ours to literally just curb it, or like the lockdown to be in place, or people to be more careful?
So socioeconomic issues are a big impediment to good health. Um, and without one, the other is difficult to achieve. So being able to eat healthy, being able to get a good balanced diet, to be able to treat people early, to have good living conditions, these are all important factors that play a significant role in any health.
Mm. And when you're talking about eating healthy, and so there's been a lot of things where we've had people say you need to drink warm water with lemon. People spoke about guavas. People speak about various things that could help make you less susceptible to the virus. What are some of those things that we can do at home to boost our immune systems, that are practical and that are not fake news? Because so many of us are telling each other various things. What can one actually do?
So I think the most important thing that anyone can do, whether you're trying to boost your immune system or just live a healthy life, I think the key factor is to eat a healthy, balanced diet and to stay
Mm,
hydrated. I think that you can obviously, with cooking yourself and eating healthy, you can obviously add a lot of herbs and fruits and vegetables that all contain vitamins and antioxidants, and these all will supplement your diet. I feel as if you are not currently deficient in something, you shouldn't be taking supplements for things that you aren't deficient in, vitamins or minerals that you
mm,
aren't in.
mm,
I think the most important is to keep hydrated, as I said, a good balanced diet,
mhm,
exercise moderately daily, and then also look after your mental health. I think that
mhm,
anxiety is something that really can affect your immune system, and it's important to just check up on yourself, to keep in contact with your family um,
mhm.
and friends. I mean, Instagram and all forms of social media are really coming to play at the moment with us keeping in touch. And I think that's also very important.
Abby is asking, what do we know about a possible vaccine for COVID-19?
So a lot of scientists are currently underway or in the development of a vaccine, which we are all waiting for. But it looks as though we'll only be getting a vaccine that would have been clinically trialed and tested within the next 18 to 24 months as it stands. I hope it's sooner, but at the moment, that's where we are situated. There are multiple
So,
vaccines being tested at different
mhm.
universities, and different scientists are all looking at different ways in which they can try combat this disease.
So South Africa has an impressive number of recoveries, but not much is said about what contributed to the patient's recovery. Buso says, can you please say some insight on what they've been taking, or what they've been taking to recover?
So, as I said, so there's no vaccination for COVID. There's also no current treatment for COVID-19. So
Mm,
there are antivirals currently also being investigated, but
mm,
none have yet been proven. So we treat patients symptomatically. I think
mm,
the key in actually combating this disease, if you have mild symptoms, is bed rest, keeping hydrated, and taking forms of analgesia, paracetamol for pain and fever. But I think these are three key points that people at home need to realize will help you get over this virus. South Africa has had over 1,000 recoveries, really great. And this is in terms of patients who have obviously been or who are recovering at home. In terms of hospital care, I think that knowing when to present to the hospital is important. So knowing that if you have signs of respiratory distress or severe shortness of breath, that you need to be seen by a doctor immediately. And I think seeking healthcare is also important if you do have severe symptoms.
So there's been a talk of how the virus mutates, and that at some point all of us would need to get it in order for it to mutate, and then we find a vaccine. What's your take on that? What do you think of that?
So, like all viruses, viruses mutate as they pass on from person to person. And mutation is just basically a slight change in the genetic code. Most mutations don't really change how the virus functions. So we have to wait and see what happens with a vaccine. And once a vaccine is developed, they'll need to be updated annually to whether or not we will gain permanent immunity, as in like with measles, where there's a vaccine, if you have a vaccine to measles, you are unlikely to gain measles again, or the flu vaccine where it's recommended that annually or every year you go and update with the annual flu vaccine.
Okay. And Sasha is asking, what would be the best prevention?
The best prevention of COVID would be currently would be to stay at home. Social distancing is really important at this present point in time, to avoid crowded areas, to avoid sick people, to wash your hands regularly for 20 seconds with even just soap and water. And if you are sneezing or coughing, to sneeze into your arm or your elbow away from others, and to cough as well into your elbow away from others to avoid the spread of the disease.
And our editor-in-chief, Nontando, is watching. She's asking, how are you coping mentally?
So I'm fortunate enough to live at home with my husband, and we spend a lot of time cooking, and we play board games when I'm off from work, and we really just have taken the time to kind of relax and rest and do a workout once a day in our living room. So these are just basic acts that we perform every day, which are normal acts, but they kind of just help you realize, I think, as a doctor working in a crazy environment, when I come home, that I can have a sense of normality. And then also just keeping in touch with friends. I've been doing a lot of calls with my friends, video calling with my friends, keeping in touch with my fellow colleagues and doctors that are on the front line in other hospitals who I'm not able to see, and then also keeping in touch with my family. I think mentally, the solidarity of all doctors is currently what keeps you going. It's not only me, not the only one on this front line. There are a lot of us, and my brother is even a doctor too. And I mean, the fact that we just all keep in touch, we keep each other going, and we keep supporting each other really helps us to get through every day.
And Bucket underscore Domo is asking, what is the situation at the hospitals with protective gears, for protective gear for patients and doctors? What's the situation with that?
So currently at my state hospital, we do have PPE. It is obviously not in copious amounts. It's not, I mean, we're using it sparingly. So we anyone who's testing for COVID patients wears a full PPE outside in the tents. All nursing staff and doctors and porters have got masks, which is really great at the moment. We do try use our masks more than once. And we also have been using, some of us have been wearing goggles just to keep our eyes protected. So that's how we protect ourselves. We use gloves occasionally for medical procedures, but I still stick to the belief that washing your hands regularly after every patient is very important. And I think we've all had it drilled into our heads from the beginning of becoming doctors that this is the way that we need to treat ourselves and treat others, by washing our hands. And also just avoiding to touch our faces at work. So avoiding touching your hair, keeping your hair back or in a surgical cap, or and yeah, avoiding touching your face and your eyes and your nose. In terms of patients, we have a separate ward now currently where we isolate COVID suspects and COVID positive patients, and anyone going into these areas will wear full PPE as well.
Okay.
Also,
So,
for patients that are coughing or are not COVID positive but do have flu-like symptoms, to just wear a mask of their own, a cloth mask will even suffice.
So, speaking of masks, I mean, there've been mixed, not necessarily reactions, mixed stories about masks, whether you should wear them, whether you shouldn't. Who should wear masks, and what type of masks are effective?
So the suggestion currently is that anyone and everyone should wear a mask when going outside of their households. At the moment, although it's not ideal, a face cloth or a cloth mask is fine, as long as you are protecting yourself and protecting others from yourself. So it's currently advised that surgical masks and N95 masks, which actually have an example. So this is an N95, an N95 mask and a surgical mask. Those are actually recommended to be used by healthcare workers, and the general public is currently advised to use a cloth mask, handmade mask, just so that these fabric face masks, they provide although not a full 100% coverage, they do provide an additional preventative measure to protect both yourself and those around you.
Oh, okay. And speaking of like cloth masks, there's another question I had as well when I sent you. Does COVID, because we know COVID stays on surfaces, so how long does COVID stay on surfaces like counters, door handles, cups, anything we touch? How long does it stay?
So basically, it's still being currently researched, but coronavirus acts like most flu viruses. So it's believed, I mean, there was a New England Journal of Medicine article recently that basically stated that it can remain on a surface for up to 72 hours. So it's a wooden surface. It can remain on for 72 hours. A copper surface, I think 4 hours, and in between that, it can so basically between 4 to 72 hours it can remain on a surface. So the most important thing to do is, if you have any suspicion of an area being infected, is to wash the area with disinfectant or soapy water. And this also applies to packets or boxes or groceries that you're getting from the supermarket, to try and, when you come home from the supermarket, to decant or take out your food stuff away from the plastic that has been put in, and put it into your own containers to avoid contamination within your household. So basically it's difficult to say, when you walk out as a person into the world, into the supermarkets, into the pharmacies, even though COVID may have been there, or droplets or respiratory droplets may be present on shelves, it's important that you wash your hands and, like I said, disinfect or remove what you have bought from the containers that's on.
Tyrone is asking a very important question here. Tyrone says, are the hospitals currently coping, and do you think they are well equipped to cope with rising numbers?
So currently we are coping. I speak on behalf of the hospital that I'm currently working at, and I don't have information on every hospital in South Africa, but we are currently running on about a 50% capacity, and we are waiting for it to get busier. We are waiting for these patients to come. So the lockdown has essentially given us time to prepare. There are far few trauma cases at the moment that I've seen personally in our hospital. So this has also decreased our bed capacity, and it's given us time to now face what we are about to face.
And Paul Pondo is asking, is there any evidence of physical long-term effects after contracting COVID-19?
So there's a lot that we don't know about corona, something that every doctor is still learning about daily. So at the moment, no, there are not, other than significant lung damage in very ill patients. There aren't any other reported effects. The virus is still too new to retrospectively look back and decide on what the chronic outcomes of the disease are. But for mild cases, it's reported that it is just like a flu-like symptoms, which if you keep healthy, hydrate well, take the right analgesia, and rest, you should get over it within 7 days.
So a lot of the reports are, unless you have pre-existing conditions, the virus will not be deadly to you. That's what most of us, if not all of us, have heard. Is that the fact, or are there some cases where someone did not have pre-existing conditions, and then the virus ended up being deadly and they passed on, or what's the situation with that?
So the majority of cases currently look as if it looks as if the majority of cases are basically I've just gone blank. The majority. Can you repeat the question? Sorry.
Okay, no, it's okay. So I was just saying, like from what we know, a lot of times we're told that COVID is deadly, yes, but it only becomes extremely deadly, or someone has to be put on oxygen, or someone passes on if they have pre-existing conditions, perhaps TB, perhaps HIV, perhaps lung problems. Is that the case, or do we have cases where someone was all right and okay, but it became deadly?
So the majority of cases look as if that it looks as if comorbidities are a predominant factor in the prognosis or how well you do with the disease, and it looks like most deaths are basically associated with patients that have um, uh, other comorbidities. So that's the majority of cases currently, but there are some cases where young patients are also dying and young patients are also not doing well. So it's very difficult to, we can't generalize. We don't know how it's going to affect us, especially given our specific circumstances and patients currently, the majority or number of patients currently infected with HIV and TB. This is something that we still need to figure out, how it will affect us and what age category it will affect us with. But it looks as if from first world countries that the majority of patients dying have comorbidities.
Renilwa is asking, when is the best time to go to the hospital once you've tested positive for COVID-19?
So if you've tested positive for COVID-19 and you have mild symptoms such as fever or cough or generalized body pains, then this is something that are flu-like symptoms that can be managed at home. So patients with mild symptoms can stay at home and are recommended to self-isolate. However, if you are experiencing shortness of breath or you feel as if you are not getting better, then it's advised that you seek medical care. And it's also advised that you keep away from elderly relatives and any family members who, like we say, have comorbidities and who could also get or contract COVID from you as you self-isolate. So the key point to take home is shortness of breath is one of the major factors that should require urgent medical care for. There is also the NICD hotline that you can look up, and if you are concerned, you can call them and they can help you with any of the queries that you currently have regarding your symptoms at the time that you're.
Okay. And Renilo has also a follow-up. She also has a follow-up question. She says, patients with comorbidity, let me just pull it down so I can read it properly. When is the best time? Okay, apologies for that. Okay. Would patients with comorbidity conditions be advised to seek medical help or wait until it worsens?
So, is the question related to patients with COVID and comorbidities?
Yes. So let's say someone has comorbidities, finds out they have COVID. Do they seek uh, attention in terms of medical assistance right there and then and go to the hospital, or do they wait until they get worse?
So, usually the person that has been tested now with COVID and comorbidities will actually ideally be at a GP or a hospital when they're tested.
Mm,
And
mm,
what we do then is we take their like for example their vital signs and their temperature, and then we decide whether or not this patient needs to be admitted or whether or not this patient can go home. But it's
mm,
important that every patient is different, and it's
mm,
advised that you speak to your doctor regarding your symptoms, whether you have
mm,
comorbidities or not. So it's a
mm.
difficult question to generalize. It depends on patient profile.
And Nick is asking, it's the second time Nick is asking, saying, can you get it one more time? So basically, are there reinfections? I think we spoke about this earlier, but just for Nick's case, can you please reply, Doctor?
So we did say that there has been reported cases of reinfections in South Korea and Japan, but we still aren't sure whether these cases of reinfection are due to false negative tests or patients who haven't yet recovered fully from their initial coronavirus. So we don't know yet about reinfection. It's something that we still have to look into, but we're hoping that it isn't the case, and that, like other flus or other illnesses, that once you've had it, you wouldn't get it again. That would really make a difference in us combating this disease.
And Paul Pombo is asking, when a person dies with the virus, can other people still contract the virus from the deceased person, or does the virus die when someone dies?
So you get COVID from droplets when you're breathing. So it's spread via respiratory particles. So if a patient isn't, or if the deceased are no longer breathing, then it's highly unlikely that you should still contract the virus from a corpse. But I'm not too sure. Although what we know about COVID is that it's spread via respiratory droplets, via coughing and sneezing. So it's unlikely that you should contract it from the deceased. However, like we said earlier, it does live on surfaces. So if that deceased person coughed or was in contact with any surfaces prior to their death, that you could contract it from there.
And does COVID stay on clothes, Doctor? So the cloth you perhaps would have put to cover your mouth, does it stay on clothes, not only surfaces? And if so, do you have any idea how long it stays? Obviously, we'll need to wash those clothes, but yeah.
So we're currently not sure whether or not it stays on clothes. It's highly likely. It's advised, and actually, it's advised that you would wash your face mask with hot water, a hot wash of the cloth mask, and then immediately dry and iron it after use. Once you get home, to avoid contamination and to avoid the spread. But we're still learning about the virus. Like I said, I think it's important to know when applying the face mask to not touch your face, to not kind of, I think it's really bad when people pull their mask down and let it on their necks, because you may have contracted virus on your neck while walking out in public, and then if you pull the mask back up on top of your face, you're then spreading the virus onto yourself. Also, hair, we're not sure. At work, we wear surgical caps, or we put our hair in a bun, and I as a doctor, come home, I take off my scrubs and my shoes outside of my house, and I put it in a separate wash. So it's important to be cautious. It's important when you do go out to be kind of cognizant of the fact that this virus could be on your clothes, the same way that it's on your hands, the same way that it's on any surface. And it's important to really maintain cleanliness.
So Renilo is asking a question. What advice would you give to someone who is an essential worker and has a family at home? What precautions would you advise them to take?
So a lot of my colleagues and friends have actually decided to stay away from their family and live separately. I think it's a personal choice. I think the most important thing to do is keep practicing strict hygiene. So if you are an essential worker, if you are a whether going out every day at this current point in time, that you are cognizant of what you have done, washing your hands, what you've been wearing, and taking off these clothes before you enter the house, and washing them in a separate load. I think this is really important. It's a difficult decision. I know I have colleagues who also have young babies who actually can't afford to leave their children. And like I said, it's with strict personal hygiene, I think we can combat the disease, but it's a personal choice. I think every essential healthcare worker is currently putting their life on the line, and I really salute all of them.
I was just looking down for some questions here that have been said. So someone is asking, what is the reality of this virus? If we just paint the reality of what this virus is to people who are watching, what's the actual reality of it?
So the reality at this stage is that we all are still learning. I think that's the most important thing to understand, that it's a virus that has taken the world by surprise, and it's very infectious. So the virus is still very new, but it's highly infectious. And that's the reality, and that's why we have implemented measures such as social distancing, strict personal hand hygiene, and that kind of thing. From another perspective, it seems that it's really affecting the elderly and people with comorbidities, and that's one factor that seems to have been pronounced around the world, that it is really affecting the elderly and patients with comorbidities, but that none of us are immune, and that we all need to take the right precautions.
And there's a question here from Rick. The question is, what, if any, extra support has our government given to our healthcare workers during this time?
So I think the guidance and the guidelines are really paramount to helping us to get through the virus, to follow protocols, to follow guidelines, to listen to our president, to basically know that we're not alone, that we're not making our own decisions, that we are all in this together, and that we're all working together. And then also providing us with PPE and giving us the motivation to continue helping people and to carry on. I think that this lockdown has really aided us currently with the situation that we're in at the moment.
And Vogue Image is asking, what happens after the lockdown? What your views on how to continue to avoid the virus?
So it will be interesting to see what happens after lockdown. I can't unfortunately predict the future, but I think it's important that we have to keep practicing strict hygiene, social distancing, being cautious, and being aware. I think we've all gone through this. When none of us are alone in it, and we've all gone through this, and we really need to really be kind to everybody else in the world who's currently, we're all suffering from different perspectives, and I think helping people that are less fortunate is also something that we should all continue to do. It shouldn't only be done in the lockdown. It's a time to pull together. It's a time to change the way we act. And it's a time to really, pay it forward and keep doing what we've been doing. I've seen some really incredible things being done. There are a lot of non-profit organizations that have done incredible work regarding, food parcels, helping the sick, helping the elderly. And I think these kinds of things, they need to be continued, whether we're in lockdown or not.
So, in terms of that, and I think the president said this in his last address, the stigma that people have, not really a stigma. I think the it's being scared. I guess it's fear that people have when someone either coughs or someone has is symptomatic when it comes to COVID. What would you say to people as to how to react to that? Let's say it's a family member who you might suspect. How do you are you cautious without making people feel alienated? What can you do?
So, fear of the unknown is inevitable. For the most part, I think it's important that we all practice, like I said, strict hygiene, and if coughing or if sneezing, that we do it away from our family members, not on. It's definitely not something that should be done to stigmatize people. And I think that if someone is unwell, is coughing, or is sneezing, then they should seek advice, and from a hotline, or just in case they are infected. It's the reality of the situation at the moment. I think it's important, without trying to create a stigma, that we do inform others on how to cough and how to sneeze, and it's something that should be practiced from now on out, if not before, because it will help the spread of not only COVID, but germs, any virus, and I think that should be done.
Okay, and we have a question here from Renela. She says, "What are your views on the treatment mentioned on the news as a useful treatment, despite any clinical trials or proof of efficacy? Has it influenced prescribing to doctors, e.g., hydro? I don't know how to pronounce that word. Hydroquinone.
Yeah. So we're not prescribing it currently at our hospital. I'm hoping that we finally come out with a treatment, with an antiviral that works, that actually treats or cures this virus. But we are waiting still for it to show efficacy. So there are clinical trials ongoing, and there are various treatments, or many treatments being tested. It's actually difficult to keep up with. It's a new drug every day that is claimed to be effective, but without the proof, it's difficult to comment on whether or not this is effective. We have to wait for the clinical trials.
Okay. Dr. Bizos, we literally are left with like 3 minutes because Instagram cuts you off after an hour. We've been speaking for about 57 minutes. Okay. So anything else you'd like to say before we end our chat, before Instagram cuts us off? We really appreciate your time. We appreciate you taking time. We know you're busy and just giving us insight. We really, really appreciate that.
Yeah, so thank you so much for giving me the opportunity. It's really been a pleasure. I think the take-home message here is to stay home, take care of yourself and your loved ones, and stay safe. I think that we need to listen to the experts, and we need to take every day as it comes. And yeah, thank you to our president as well, for really guiding us and getting us to where we are at the moment. For any further information, you can always go onto the NICD website, WHO website, as well as the Department of Health. I think we'll get through this together if we all stick together, and as South Africans, that's what we seem to be good at doing. It's a long road ahead, but yeah, thank you to everyone who's staying at home, and thank you to all the essential workers as well out there who are making a difference in the world. Thank you so much.
Thank you.
It was lovely meeting you.
Lovely meeting you too. Thank you, Dr. Agi. You are our hero, literally. You as essential workers are our heroes, and we really thank you for putting your lives on the line for protecting us. We appreciate it. For those who are watching, thank you for joining us for the chat. It was really, really wonderful. And again, we thank Dr. Agi for making time for us. The chat will still be available on our story, so we'll save the chat so you can go back and listen to the chat again. If there's something you didn't hear, yeah, definitely. Thank you.
Well, thank you so much. Bye. Keep safe.
All right, keep safe, Dr. Agi. Bye-bye.